There's a really neat collaboration that is with Janssen, and we looked at the economic burden of tumor lysis syndrome. So this was something using claims data, so I was very excited to collaborate with them on this type of project. So for anyone who doesn't know, tumor lysis syndrome occurs when you have so much breakdown of cancer cells that it releases uric acid, electrolytes, and other toxins into the blood. It can result in hospitalization, need for dialysis, and death if left untreated. CLL has a pretty high risk of tumor lysis syndrome with several drugs. So this study actually goes back quite a ways and looks at treatments that are in the guidelines at high risk for tumor lysis syndrome. So this includes Obinutuzumab, chemoimmunotherapies, and Venetoclax. What the study was looking at patients who develop tumor lysis syndrome within 90 days of starting one of these therapies that's in the guidelines at having high risk for tumor lysis syndrome. And then it's kind of divided into 30-day segments. And so segments in patients that never develop tumor lysis syndrome are considered non-TLS segments. And then if someone develops tumor lysis syndrome, 30-day segments before that are considered non-tumor lysis, and after that are considered tumor lysis, kind of ongoing, which was the most feasible way to look at this. But you do have patients that could contribute to both TLS and non-TLS segments or data. We found that, unsurprisingly, the cost of taking care of patients who did develop tumor lysis syndrome was more. So it was more expensive per month to take care of people that had tumor lysis syndrome, and that was mostly driven by inpatient costs because people are hospitalized for this. So while this isn't a surprising finding, I think it is really important to realize what a burden tumor lysis syndrome has on the healthcare system. We did also look at Venetoclax, which has a very important and strict tumor lysis syndrome mitigation strategy, including slow dose ramp up and monitoring scheme, and found that that was more costly at initiation than some of the other therapies, but the cost of tumor lysis syndrome, if people developed it, was more. So this is probably a very worthwhile strategy to do anything to mitigate that risk, even if there is some economic burden to that, just because developing tumor lysis syndrome from an economic burden standpoint that's really a high burden. Also, people who develop tumor lysis syndrome are more likely to switch therapies in the near term, and I think that's important too. So really the results were what we expected to see, but it's important to confirm that using real-world data sets in this manner. And also, I think this kind of adds to what physicians need to think about when choosing a regimen that has a risk of tumor lysis syndrome, and also that this is something that they need to discuss with their patients. So it was a really fun collaboration with Janssen that I enjoyed working on with them.